Chapter 3, Drug Use, Regulation, and the Law. So in the U.S., drug development and marketing started with really looking at needing to rely on highly trained experts and government watchdog agencies in order to protect consumers. Guidelines for controlling drug development and marketing began. So we had the right to protect against damaging effects of drug use, so abuse-related information, side effects, things like that, and the right to demand approved drugs that are safe and effective, so that drugs are what they say they are. The 1906 Pure Food and Drug Act. This is where the federal drug regulation aimed to allow consumers to make choices for themselves. The public should have information about possible dependents, producing drugs, and that's in order to ensure that they understood the risks that were involved with taking those drugs. There was misrepresentation and it became illegal. This marked the beginning of governmental agencies. This marked the beginning of governmental agencies being involved in drug manufacturing. The road to regulation and the FDA. Sales of uncontrolled medicines were common in the 1800s to 1900s. There were patented products that were available to the public, however, the ingredients inside of them were secret. The focus on food over drug products were labeled non-addictive. So the 1906 Pure Food and Drug Act required manufacturers to list the amounts of alcohol, morphine, opium, cocaine, heroin, and marijuana extract that were inside of them. The 1912 Shirley Amendment. This is where the government was unable to stop the distribution of dangerous products. There was really, at the time, nothing in place to deal with the false claims of effectiveness, so the Shirley Amendment required that labels... Why does this keep coming up? That labels could not make any false claims or fraudulent statements about the effectiveness. It really did require the government to prove fraud, which isn't a good thing. And it did not improve products, but it just made labeling a little bit more vague. Prescription versus over-the-counter drugs. So this is a relatively new distinction. Anything available without prescription was considered over-the-counter. The inability to prosecute for toxicity or for not conducting prior animal testing just wasn't there. So the 1938 Federal Food and Drug and Cosmetic Act, this is where the FDA was given control over drug safety, defined drug products that affect the body structure or function. You had to file applications with the government for all new drugs showing that they were safe but not necessarily not effective. List the quality of all the ingredients. Provide instructions on current use or correct use. Warnings about the dangers involved with taking that drug. It eliminated the requirement that the government had to prove fraud, which was a good thing, but it allowed drug companies to create a class that could not be legally sold without a prescription. The 1951 Durham-Humphrey Amendment required that manufacturers determine prescription versus over-the-counter, and it could be different by manufacturer. So the Durham-Humphrey Amendment established criteria to classify, and it is still used today. So medications are considered a prescription if they are habit-forming, the toxicity level is unsafe for self-medication, it's new and it hasn't been shown to be safe. Almost all became prescriptions. Your more potent antibiotics and tranquilizers, typically, that were just too potentially dangerous to sell over the counter. Thalidomide. So thalidomide was a drug that did not receive proper testing, and it was given to women to help alleviate morning sickness. But what happened was those women who took thalidomide during their pregnancy had children who had basically underdeveloped limbs and either partial or no limbs, as you can see in these pictures. So the Kefauver and Harris amendments, this is where enormous profits were being made by manufacturers without competition and regulation issues. So for example, the thalidomide distribution, there was an unapproved supply for investigational use, and again it was given to women who are pregnant to help alleviate morning sickness, and then their offspring had major issues. So this amendment strengthened regulations of introduction and production of and sale of new drugs. It required that companies demonstrate efficacy and safety. The FDA could retract approval and could regulate and evaluate drug testing by manufacturers and mandate standards of good policy. The amended Federal Food, Drug, and Cosmetic Act continued to be enforced today. It requires all new drugs to be registered with and approved by the FDA. The FDA is mandated to ensure rights and safety, and that's during clinical testing of experimental drugs, evaluate test results of safety and efficacy, and compare benefits and risks to determine if the drug should be approved and marketed. Manufacturers must follow steps to obtain FDA permission and approval. We're going to stop here and continue on, so if you want to take a break, go ahead and take one, and we will continue in the next lecture.